Hi, I'm Dr. Laura Machado. I'm Director of Bariatric Services at Mercy San Juan Medical Center, and I've been a bariatric surgeon for the past 20 years. Honestly, part of the reason I connect with my patients so well is I've always struggled with my weight, always. And my patients see me bounce literally in a 25-pound range at one point in the year versus another, and I struggle with it constantly. So the things that I actually tell my patients to do, I try to do to my best ability on a daily basis. But if I ever lose this battle like I did, 15 years ago, I weighed 240 pounds. But if I go back there again, I'm going to get bariatric surgery. Bariatric surgery is the practice of treating the disease of obesity with various surgical procedures. It treats a patient's weight and the associated medical comorbidities. When a patient has the disease of obesity, they do not respond to simple reductions in caloric intake or exercise. Typical diet and exercise efforts do not work. Their body actually doesn't respond to that. The metabolism slows when a patient tries to go on a diet and lose weight, which is why diets don't work in the setting of the disease of obesity. From a short-term perspective, bariatric surgery results in fairly efficient weight loss. Most patients are done losing weight within 9 to 12 months post-operatively. And during that time, many of their medical comorbidities resolve or significantly improve. They go off many of their medications, they're feeling much better, and they're able to participate in exercise without it being uncomfortable. From a long-term perspective after bariatric surgery, they've decreased their chance of death. They've decreased their mortality by at least 40 to 50%, and they've decreased their risk of cancer on average by 60%. I think most patients are unaware of the fact that the gastric bypass procedure in particular puts diabetes into remission about 80% of the time post-operatively. The benefits to a patient becoming non-diabetic are significant, not only for their current health, but for their future well-being and longevity. There are numerous procedures in the realm of bariatric surgery. The most commonly performed procedures are the gastric bypass procedure, the vertical gastrectomy procedure, and the adjustable gastric band. They all work in different ways to provide a variety of benefits to patients, and they're typically performed laproscopically through 4 to 5 small incisions, which allows for a quicker physical recovery and typically an overnight hospital stay. We often think it needs to be an extremely overweight patient. The thing that a lot of patients think about is my 600-pound life, and that's really not the average patient that's undergoing bariatric surgery. It's a patient in a BMI range of 35 to 50 typically. These are patients who are about 70 to 150 pounds above ideal weight, who have obesity-related comorbidities. The majority of bariatric surgery is actually performed in women, but from a medical standpoint, men should be seeking out this treatment actually a bit more. They have higher risk factors, they have higher incidences of premature cardiovascular death, and their obesity tends to be centralized in the middle of their abdomen, and that's the dangerous place for fat to accumulate. So from a risk standpoint, we should actually be encouraging more men to seek bariatric surgery sooner. The process of undergoing and preparing a patient appropriately for bariatric surgery is fairly complex. Prior to surgery, we want to educate the patient on their nutrition and what they will be anticipating their nutritional pattern to be like following surgery. We often practice this for a number of months to prepare a patient in that direction. At the time of surgery, they're closely followed on a monthly basis to help the patient transition through the healing process, to go through different stages of their diet, to develop their new bariatric dietary pattern. What is risky is the disease of obesity and the effect it has on a patient long term. So it's actually more risky to stay significantly overweight than to undergo bariatric surgery.